Scarlet fever. Scarlet fever is a contagious infection that mostly affects young children. It's easily treated with antibiotics. The first signs of scarlet fever can be flu-like symptoms, including a high temperature, a sore throat and swollen neck glands, a large lump on the side of your neck. A rash appears 12 to 48 hours later. It looks like small, raised bumps and starts on the chest and tummy, then spreads. The rash makes your skin feel rough, like sandpaper. On white skin the rash looks pink or red. On brown and black skin it might be harder to see a change in color. A white coating also appears on the tongue. This peels, leaving the tongue red, swollen and covered in little bumps, called strawberry tongue. The rash does not appear on the face, but the cheeks can look red. The redness may be harder to see on brown and black skin. The symptoms are the same for children and adults, although scarlet fever is less common in adults. See a GP if you or your child have scarlet fever. Symptoms do not get better in a week after seeing a GP. Have scarlet fever and chickenpox at the same time or ill again, weeks after scarlet fever got better. This can be a sign of a complication, such as rheumatic fever, or feeling unwell and have been in contact with someone who has scarlet fever. Scarlet fever is very easily spread. Check with a GP before you go in. They may suggest a phone consultation. What happens at your appointment? GPs can often diagnose scarlet fever by looking at your tongue and rash. Sometimes they may wipe a cotton bud around the back of your throat to test for bacteria. Arrange your blood tests. Treating scarlet fever. GP will prescribe antibiotics. These will help you get better quicker, reduce the chance of serious illnesses, such as pneumonia, make it less likely that you'll pass the infection on to someone else. Things you can do yourself. You can relieve symptoms of scarlet fever by drinking cool fluids, eating soft foods if you have a sore throat, taking painkillers like paracetamol to bring down a high temperature. Do not give aspirin to children under 16, using calamine lotion or antihistamine tablets to ease itching. How long scarlet fever lasts? Scarlet fever lasts for around 1 week. You can spread scarlet fever to other people until 24 hours after you take your first dose of antibiotics. If you do not take antibiotics, you can spread the infection for 2 to 3 weeks after your symptoms start. Is scarlet fever dangerous? Scarlet fever can be a serious illness, but thanks to antibiotics, it's less common than it used to be and easier to treat. How to avoid spreading scarlet fever? Scarlet fever is very infectious and can easily spread to other people. To reduce the chance of spreading scarlet fever, wash your hands often with soap and water. Use tissues to trap germs from coughs or sneezes. Use tissues as quickly as possible. Do not share cutlery, cups, towels, clothes, bedding or baths with anyone who has symptoms of scarlet fever.